Welcome to MassBio's weekly town hall with President and CEO Bob Coughlin. I'm Jennifer Nason, Senior Director of Communications at MassBio, and we're thrilled to have with us today Steve Walsh, President and CEO of the Massachusetts Health and Hospital Association. Welcome, Steve. Thank you for joining us. Welcome, Bob.
Yeah, and thank you so much, Jenny. Thank you for kicking this off, and welcome to each and every one of you to our weekly virtual town hall here at MassBio. I am so excited today to have the guest that we have on board with us. Steve Walsh is the President and CEO of the Massachusetts Health and Hospital Association. He runs the trade association that represents the best healthcare system in the world. He represents the best and brightest world-class academic medical centers that our industry enjoys such an amazing partnership with. And not only am I excited to have him on board with us here today in his role as CEO of MHA, but also because we're longtime friends. Steve and I had the pleasure of serving with one another in the Massachusetts House of Representatives. We went in as classmates together. And I didn't stay as long as Steve did in the House, and I'm grateful for that, because if it weren't for Steve's leadership, and he ascended to the role to be chairman of the Healthcare Finance Committee, and Steve paved the way for healthcare reform in Massachusetts, and he did it in a way that would ensure that innovation would remain a priority here in the Commonwealth of Massachusetts. He was always a huge supporter, and still is, of our industry, and Massachusetts wouldn't be the best place in the world for the life sciences if it were not for the leadership that Steve showed while he was in the House of Representatives. So first and foremost, I want to say thank you to you, Steve, for your leadership and your years of service. And now I want to say thank you again because of this partnership that MassBio and Mass Health and Hospital Association have, and we'll talk a little bit more about that today on this town hall. So folks, thank you for joining in today, and I'm sure you're going to truly enjoy hearing from Steve Walsh, the CEO of the Mass Health and Hospital Association. Back to you, Jenny.
Thank you so much for that introduction for Steve. Steve, we're thrilled to have you, and I'm going to dive in with some questions, but just wanted to remind the audience that we want this to be an interactive discussion, so please just ask your questions throughout. We'll get to as many as we can. So first, Steve, I mean, we're in the surge, right? We're kind of in that period that we've been waiting for in Massachusetts. So can you just tell us a little bit about, how are hospitals doing? Are they prepared for this surge?
Yeah, thanks, Jenny. Thanks again for having me, and obviously, longtime friend of Bob's. Good to know that he can still talk underwater with his long introductions. He stayed for a cup of coffee at the State House, and then he moved on. But he moved on to do incredible things for patients. And that's really what drives us all, is taking care of patients. I know it's what drives the folks on the call today. And Bob is obviously both personally and professionally invested in your industry in ways that I've never seen. So proud to call him a friend, but obviously privileged to be able to join him professionally at this time. But to talk a little bit about what we're seeing, it's been a real interesting couple of months, as you all know. And back 8 weeks ago or so, when news kind of came that we were going to have to increase capacity in such significant ways, hospitals took the unprecedented action of emptying their facilities. So even though handling the surge now, you're not seeing the kind of challenges that you see when you turn on the news in some other places. But to put that in perspective, our ICUs today are at 125% capacity of what we had for original ICU beds. So, but for the actions that our hospitals had taken, you would see people in the streets outside the facilities unable to get in. What hospitals did in planning was canceled all elected events, canceled all scheduled procedures, and literally emptied their building. And they made every one of their buildings complete ICU segments, so that the whole interior of the hospital became an ICU department. And everything outside the hospital was for med-surg, for those traditional patients that you see. And those were held in field hospitals, in step-down units. And I've never seen folks work so collaboratively to make it happen. It's been remarkable. It hit first here in the Berkshires and in Boston. and then it kind of spread throughout. And right now we have some regions that their censuses are fairly low. They have managed it well. Some folks in the Cape area, out in the Bay State region, in Springfield and in the Berkshires, but in Central Mass, in Worcester, in the South Coast region, in Boston proper, it is still a battle every single day, and you're seeing it. I can remember coming on an all CEO call about a month ago now, 5 weeks ago, and reported the first death due to COVID, and was a little choked up as reporting to our CEOs that we had lost a life. And looking back on that now, you see, wow, where are we today? We turn on the news and the numbers are just staggering. So proud to be in this industry, so proud of the work that our hospitals are doing every day to keep patients safe and to manage this crisis. And again, as I said at the outset, so proud to be able to stand with MassBio and those in the life sciences industry, because I know Bob wants to get a little bit of the partnership that we've had, but the work that you and your teams have done has been simply heroic as well.
Thank you, Steve. I mean, it definitely sounds like, I mean, hospitals have done everything they can to really shift their operations to accommodate, for this surge. And what are some of the most kind of innovative strategies you've seen within hospitals, kind of on how to accomplish all of this?
Well, I can tell you, I never set up a field hospital until 6 weeks ago. I mean, the Army Corps of Engineers, it's remarkable what they were able to do. And we have some of our CEOs that are really good at this. They were medics in past lives. And so when you see the innovation, and you've seen it in other parts of the country, but it's pretty remarkable when you think about taking an exhibit hall, and all of you that have been to an exhibit or a trade show, even in your day jobs, can appreciate that exhibit halls have a bank of walls on one side that's generally the bathroom, a large bank of walls on the other side that usually goes to the ceiling, and power every 6 feet, because that's where folks set up booths. Well, that's how you create a field hospital. On the large bank, you put the oxygen tanks, and then every 6 feet, you have a power source that goes to a bed, and you can accommodate hundreds of people in the BCEC or in the DCU Center or at Mass Mutual or the Joint Base down the Cape. And it's been really incredible to see the type of innovation to be able to stand up full hospitals outside of the walls of the hospital in a matter of weeks. And then the work of government, the work of this administration, Governor Baker, Secretary Sutters, to be able to remove every regulatory burden to open a hospital in hours in some instances, to talk about innovation and everyone coming together for the common good and the commonwealth. The response has been remarkable.
Yeah, Bob, maybe you could add to that. I mean, just in terms of everyone coming together. I mean, you always talk about industry, academia, government working together, and that's why we're the best life sciences cluster in the world. I mean, what have you seen from your perspective on that partnership?
Jenny, you bring up a wonderful point. The way we've become the best place in the world for the life sciences is by having academia, industry, and government working in a true partnership. We did that. Now, when a pandemic like this comes along, how is it that we can get through it in the most effective way? Well, that teamwork and that collaboration is more important than ever. And I really think right at the onset, before Steve, you talked about the day when we heard about that first COVID-19 related death, and it was devastating. But for days leading up to that, our industry was working so closely with the healthcare providers in a way that we've never worked with them on supply chain, right? We lived in a world, and we live in a world of, just-in-time inventory. We've talked about how we can't do that anymore. We need to move towards just-in-case inventory. When the Mass Hospital Association member companies were under the leadership of Steve and his amazing team at MHA, they were pulling together what the needs were out there, because there were different sets of needs for different types of healthcare providers. You have the big, massive healthcare systems all the way down to the community health centers, right? And MHA represents them all. We needed to find out what their needs were. And at the same time, the amazing team at MassBio and MassMedic were working together to inventory our member companies to see what was out there. And we didn't expect that we could build out this supply hub, have an idea in 24 hours, have it built in 48 hours, and now have over 500 member companies participate in it, to the point where it's so successful that the state is managing the portal now for whether it's PPE donation, procurement, or personnel volunteering. Because and to just see how our trade associations got together to lead the way to set the example, set the bar, whatever it is that you want to say, to show how we can work collaboratively. Now, moving forward, we're talking about clinical trials. How are we going to get antivirals, therapies approved as quick as humanly possible, and ultimately a vaccine? Clinical trials are done in collaboration with the care centers, right? That's how we need to do it. How can we bring in AI? How can we bring in digital health? How can we do field operations out in the field the same way we are going to for testing? I mean, we've been on many calls talking about where the science of diagnostics are going to go. In fact, on this on a town hall, we talked about the difference between testing for virus versus testing for antibodies to see if somebody has built up an immunity already to this virus. And where is the science that's going to enable us to do that in a timely, efficient way? I mean, these are the things that we're talking about now regularly, because once these hospitals get on the other side of the surge that they're on right now, they're right in the middle of it right now. And Steve, I'm sure we'll talk more about that, but we need to start talking about what's next. How do we get people back to work? How do we work efficiently so that those therapies and vaccine ultimately come to us? I mean, we've never thought that we'd ever be in a world where the most important thing to the entire world's economy is a vaccine, right? Right now, we're focusing on saving lives. That's what Steve and his groups are doing. But we're going to start thinking about what's next after this.
Bob,
Yeah.
I'm sorry. I want to go back to you're obviously moving ahead and thinking ahead, as you always do, being innovative. But I want to go back to that partnership you talked about, because before vaccines was the most important thing, personal protection equipment was the most important thing.
Right.
People didn't know what PPE was. And now we're looking at PPP, and that apparently is the small business loan. PPE, the single most important thing in this fight is PPE. And there's real stories. And so when you talk about the largesse of the model that you built, and your team such a superb job on with MassMedic, and you brought in the Conference of Boston Teaching Hospitals and us and members of our team. But it's different. It's more personal than that. There was a Sunday afternoon, you and I were on the phone, and a small hospital in the southeast corner of the state ran out of N95 masks.
Yeah.
We're out. One of your companies got masks that afternoon so that they could continue to see patients. And I don't want to get into naming people because I'll forget someone. I know there's going to be an opportunity to acknowledge the incredible work. But when they sent what they had into a supply hub, the part of that I don't want to be lost on anybody is that ended up on a frontline caregiver that was able to take care of a patient because of the work that you and your members did. It's truly remarkable. And I walked in the building today, there's 17 pallets in my parking lot that are filled with stuff that's going out to hospitals. There are shields, there's hand sanitizer, there's gowns, there's masks. If it's in our parking lot, it means it came from MassBio or from your member companies. And so I appreciate you putting the point on the big picture, but I also want to pause and say, we wouldn't have been able to be in this fight if we weren't able to protect our frontline workers. We wouldn't have been able to protect our frontline workers in large part with nimble response on those times of need if it wasn't for your members. And that shouldn't be lost on us.
Well, thank you, Steve. And, we're just trying to do what we can as an industry to help those on the front lines. And we are very proud, but thank you for those kind words.
Yeah, and let's talk a little bit about, what do hospitals need from industry right now? What's next? What do the next few months look like, and what is the big need there, and how can our industry help even more beyond PPE?
Yeah, well, I think that's where Bob is kind of launching to what the next generation is, which is testing and vaccinations. That's ultimately going to be where we're going to have to go and where we can partner most effectively. And that's the way we're going to reset and get back to work. But it's going to be a weird phenomenon where, that several months ago when we're buying PPE, we're the only folks buying it. And Bob and you and I have been talking about this offline. We're a month away from every single business in Massachusetts and around the country needing thermometers and wipes and sanitizer and masks and gloves just to do commerce. So the interesting part about the hospital industry is we were competing with other states and maybe other hospitals. Now we're going to be in a global competition for PPE with everybody. So your industry continuing to innovate is the fastest and most effective way for us to get out of this challenge, because the way to get out of the challenge is ultimately going to be through a vaccine. And until that time, it's going to be an odd few months. And we're probably looking at a phase 2 resurgence in the fall. And the hospitals are going to have to be able to stay open and have the capacity to meet that demand when and if it comes later on this year.
Hey, Steve, could you add a little bit more about something that I've learned about the hospital business as we go through this exercise? You know, when a lot of people think about Reset is our program, restarting the economy safely through employee testing and training, right? When I was thinking of restarting the economy and resetting business, I honestly didn't think of hospitals, because in our minds, you're up and running anyway. Could you explain the difference between what responding to a pandemic means to the business of a hospital versus elective surgery, seeing sick people, and how you run the business in a normal time?
Yeah, it's a fascinating, we look at these $1 trillion packages that are coming back down from the federal government, and they've been generous, and the state has been an incredible partner. The hospital industry is losing $1.4 billion a month. So at the end of July, no matter how, even if everything hits at the best possible scenario, we'll be down about $5 billion. And that's because canceling elective surgeries or scheduled events means you've pushed everything profitable out of the building, and you're only dealing with the COVID response, which is absolutely necessary, what everybody welcomed, what we had to do, but no one is reimbursing for putting up a field hospital or for the other things, the other ancillary costs to deal with cases. For the price gouging that's taking place in many ways with overseas companies on PPE. So all those things are just the cost of doing business. Now, we're so sensitive to the fact, though, that the rest of the economy has stopped. And there's a lot of other people hurting, too. And so it's really hard to focus on money in a time of need. But we can't have hospitals going out of business in the biggest pandemic in 100 years. We have to be able to meet the needs of our patients. So we're really concerned that coming out of it, there is going to be a weakened healthcare system to respond to the next wave of it. And I think that's where we will be leaning heavily in partnership with your industry to get to the next level of this.
Yeah, and I think, thank you for sharing that. And I think it's important for the audience to understand, we work in the life sciences, but when you look at healthcare, healthcare is the largest employer in the Commonwealth of Massachusetts. We're a leader in the healthcare business, and we need to continue to be so. So it's important that we're all sensitive to the business challenges that the hospitals face and will continue to face. So thank you for sharing that.
Absolutely, and I want to get back to how this may change, how hospitals operate. But first, Bob, you also brought up the idea of clinical trials. We really need to find a way to get clinical trials, both for COVID-19 therapies, treatments, vaccines, but also for all the other diseases out there. I mean, there are so many unmet medical needs that our members are working on. So how can industry and providers, work together to get those clinical trials back up and running? And what can industry do to support on your end, Steve, to support with the hospitals who are a huge part of those clinical trials?
Yeah, I think, in crisis lies opportunity. And I think that is your industry, as you know, it's not a secret, has been under siege and under attack for some time now, as has ours in many ways because of the cost of healthcare. If there is ever a light that has been shined upon how important we are to public health, it's right now. And we're in tandem with you. I mean, we are both personal and professional partners in saving lives. And that's the future. I see a bright future of partnership between life sciences and hospitals that I think will be deeper and more profound than ever before as we come out of this crisis. And frankly, I'm excited about that. Because if you look at the numbers for April, nobody came into hospitals with heart disease, for cancer diagnosis, for treatment, for stroke, nobody. But percentages don't lie. So that means there were as many people that were home, afraid to leave their house because of the crisis, afraid to go and get necessary care, that now they've been putting that off. And that care is going to be a lot more difficult for both your industry and our industry to meet the demand of when this is all over. And so innovation and doing what you have to do to get drugs from the bench to the bedside in the next phase of this is more important than it's ever been before, I think.
Yeah, to build off of that, Steve, and you make some great points, to think of, people typically, A lot of people who are participating in clinical trials have underlying health conditions. That's why they're in the clinical trial. The last place they can be going right now is to hospitals. So it's forced us as an industry to take a strong look at, are there other ways to keep clinical trials moving forward by using digital health? The same way we have all, as a society, gotten better at telecommuting because as a result of this, there are going to be ways that we are better equipped to be more efficient as it relates to clinical trials. I mean, this pandemic has been horrible for companies that had clinical trials underway for all these unmet medical needs other than COVID-19 they're still out there. They're not going away. So, I've found that a lot of the companies are working with digital health companies to try to come up with better ways so that we can remotely monitor patients while they're in clinical trials. And I've seen some great advancement just in the last several weeks. And I think that will continue. You're right, Steve, the future is bright. Once we get through this, I think we're going to be a lot better and more efficient at how we do a lot of things. And I also think that when you look at the healthcare industry and the life sciences industry, we are going to be more homogenous and we will work better together. Not that we didn't already work great, but we're going to be able to work so much better moving forward. And that's a good thing for patients.
Well, and I hope that you will, you collective in your industry will just push innovation harder and faster than ever. I mean, you have been leaders on it. I look at what you and your board did, even in calling out some of the challenges with transportation. Now, it shouldn't have taken a global pandemic for us to see what could happen when the roads are open and pollution is down and people are working from home. But we have learned to work differently. So your industry was ahead of the time in that, right? So now your industry is pushing us to do other things that are innovative relative to clinical trials and we ought to embrace your ideas because they're good ones. It took us 12 minutes collectively and collaboratively to stand up telemedicine in Massachusetts. It's been on hold for 12 years.
Yes.
So long. And now here we are. So there's going to be some lessons learned that are really positive for some things that I think you, your member companies, your board have been pushing for some time that we ought to be listening to you now. We ought to be working together to make them happen.
Yeah, Steve, maybe you could talk a little bit more about, you kind of started alluding to this, but how is this going to change the way hospitals operate in the future? Do you envision kind of long-lasting impact from this pandemic?
Yeah, I do. I mean, because I don't think it's going away, right? So I think we're going to be in this for some time. Some estimates say 2022, 2021, or until a vaccine is in place. But this is all, I always thought this would come full circle. We talked about a little bit in 2012 when we were trying to stand up accountable care organizations. Mm-hmm. The doctor's visits are going back home. We're coming full circle to where we started. Mobile integrated healthcare, moving care into the home. Why do people need to leave their house if they don't want? Let's put a rolling unit, right? You call 911, you don't want to go to emergency room. It's the worst possible place to be. So let's get a rolling unit out to your house, meet you where you are, triage and treat, and set you up for a follow-up appointment. Now, on the other side of that, we're going to have to make sure that we have strong, financially strong hospitals to meet demands when and if times like this occur. But the day-to-day way we deliver care can change, should change, and will change, I believe, because of this, because we've learned how to be so much more efficient throughout this time.
Absolutely. We do have a question from the audience. James Kaufman is asking to both Steve and Bob, any thoughts on the new MGH model suggesting that current restrictions could be kept until late June and the approaches companies should take to maintain productivity over the next few months?
Yeah, so I can jump in, Bobby. You can then build off it. Listen, that model is probably pretty close to accurate. You know, that we're going to be looking at this stay-at-home order being extended for some period of time. Governor's talked a little bit about it over the last several days. Mayor Walsh has talked about it over the last several days. But nobody is going to open until it's safe to do so. The virus doesn't know any geographic boundaries. And so it is very interesting to see. You could have two hospitals in Western Mass, 8 miles apart. One is absolutely full with COVID-positive patients and one is empty. It's really remarkable. So the stay-at-home stuff has absolutely worked. How to become and stay productive throughout a longer period of time is something each company will have to come up with on their own, because I think you'll see phases of people coming back to work. But you're going to have some employees that are just scared. They don't want to come back right away. They want to make sure that it's safe. You're going to have a PPE challenge to make sure we have the necessary equipment for people to come back to work. And that's not going to just take into June. And that's probably going to be throughout the summer until we get into a good rhythm as to how to be able to work through this kind of new normal.
Yeah,
Bob,
Jenny,
maybe you could offer more on how companies are thinking about getting back to work.
Yeah, I would direct the audience towards the MassBio webpage and check out on our COVID-19 resource page. We do have best practices to get folks the back to work plan for labs. It's geared more towards our industry, but take a look at it, because that list and those procedures, and that's phase 1 of our reset program. That came as a result of surveying many small, medium, and large companies to get best practices in place. I'll also add that that's a fluid document. It will be changing as new ideas and new problems surface. But as essential life science employees, we've done a good job of only having the people be at work that need to be at work. Now, as we start getting more people to come back, one, it's important that it's done safely. And to Steve's point, there's going to be people who have underlying health conditions that will not be coming back to work in the office until there is a vaccine or a real good antiviral out there. But yeah, it's important. The governor is putting together a task force that both the MHA and MassBio and all of the trade associations are engaged regularly with to try to come up with these best practices to share with the administration. And I also agree with Steve. I think the governor is probably going to have to come out and extend the shutdown order for a little bit longer. And again, but now it's the point that we need to start thinking about how we get our folks back safely, and we're working on that.
Perfect. And we're going to take one last question from the audience and then just closing thoughts. But Pat Abbott is asking, forward thinking to a successful model, who in healthcare is planning for how a vaccine could be delivered to the public?
Well, Pat, it's funny you should ask that. When you look at Project Reset, which is restarting the economy safely through training and testing, there's 3 phases. Phase 1 is what I just outlined, giving people the best practices to get back to work. Phase 2 is a testing procedure that will go around getting people back to work. Phase 3 of that is actually, how do we work with industry to ensure that we are using some of these platforms that we have in place in Massachusetts to expedite clinical trials for all of the companies that are doing vaccine research, not just one or another, all of them. How do we continue to work with these companies so that whoever does come up with the vaccine first, collaboratively, these companies are using their manufacturing capability to manufacture? Because think of the millions upon millions of doses. We'll need 6 million doses in Massachusetts alone for vaccination purposes. We're also working collaborative with Mass Hospital Association, and having some conversation with folks in government to put together a plan so that we can actually operationally execute vaccinations out in the field. This probably isn't the right place to have that discussion because we're running out of time, and it is a broader discussion. But Steve, while he was working in the legislature, actually crafted legislation that created a vaccination program for infants here in the Commonwealth that may be able to be expanded to COVID and adults. So we are working on that, and it will be hopefully another area where Massachusetts can lead the way and help other parts of the country and other parts of the world get this vaccine into people so that we can build herd immunity through inoculation.
And Bob, you've been leading the way on this. I'll just add that traditional vaccinations haven't stopped because of COVID. So there are some real innovators in the hospital community. Boston Medical Center is being one that has a rolling vaccination van, coupling the work that you and your members and team are doing around vaccines with some of the other ways we're able to deliver service. And I think we should be looking at urban centers, high dense areas, people that work on the front lines, folks that are on rapid transit or public transportation. So if you're going to be around a lot of people in a dense area, let's prioritize vaccinations in communities there where we make sure that we're taking care of dense communities for people that might travel around where a virus could move uninhibited through public transportation and other ways so that we can put people back to work.
That's right. And when you take the vaccination plan and you merge that with what's happening with contact tracing, et cetera, we could put together a pretty compelling story on how we could wipe this thing out quicker than other parts of the world, other parts of the country even. And we're going to continue to work. Pat, that's a great question. We can talk more offline. That plan is not ready for prime time yet, but we're working really hard on it.
Perfect. Well, thank you both. Believe it or not, we're just a minute over time. So,
Oh,
I mean, Steve, thank you for joining us. Any kind of parting words for the audience or anything, else that we can do to support the amazing work the hospitals are doing?
No, it's really just to finish where we started, which is to say thank you. The synergy we have right now with your members is pretty extraordinary, and all that you have done for our workforce and be able to meet the demands of our patients is, as I said, heroic. And I appreciate everything that you, Jenny, Bob, your board, your leadership team has done with your member companies to be able to make sure that much needed supplies are getting where they need to go so that we can beat this awful virus and take care of the patients that walk through the doors of our hospital. So thank you for that.
yeah, Steve, and if we could add on behalf of the entire industry, thank you to all the amazing men and women that go to work every day on the front lines, trying to keep people from dying. There's not a more noble profession in these times than what the amazing people of your organization are doing. So through you to your board and to all of your member institutions, thank you so much for your leadership. You guys have done an amazing job, and I'm proud. We're all proud to be associated with you, and we're all proud to be from Massachusetts. So thank you.
Thanks, Bob. Thanks, Jenny.
Well, thank you both, and thank you, audience, for joining. Please tune in next week at 11 a.m. as always, and we hope everyone has a healthy and safe week. Thanks again.